Good afternoon. This is Dr. Jackie Moline. I'm the director of the Queens World Trade Center Clinical Center of Excellence and the vice president and chair of the Department of Population Health at the the Hofstra North Shore LIJ School of Medicine, North Shore University Hospital, and Long Island Jewish Medical Center. Thank you for joining us today. We're going to be talking about after the towers fell, the long-term public health impact and lessons of 9/11. So this picture represents, after the towers had fallen, the prevailing winds, and this is before the towers fell, but you can see the cloud of smoke after the tremendous heat generated from the collision of the two aircraft into the World Trade Center towers. As the buildings were crashing, you can see the huge dust cloud, which will have tremendous significance going forward for those who were caught in the dust cloud. And this aerial representation of the cloud as it advances over lower Manhattan gives a perspective on the pervasiveness of the exposures in this area. There are buildings that are wholly consumed by the dust that we can't even see, as the dust went through the canyons of lower Manhattan and the exposure was widespread. We know that tens of thousands of public servants, and here we see a firefighter putting out some of the fires that raged early on before the towers even collapsed. And we can begin to see the ash and the dust, and this is just when the planes hit the towers. After the towers fell, though, we not only saw the public sector, the traditional first responders, we saw private sector workers coming to help. And here these are iron workers who came in using their skill set in a very, very active recovery mode or rescue mode at this point. They were cutting through steel looking, and as you see this gentleman here, he's not wearing a mask. He's on a pile of rubble that is fairly unstable. Now we know that over 100,000 local workers and residents were in the area. And the thing that was so astonishing was that every single person had the same skin color that day, and that was the color of ash. Anyone who was in the dust cloud was covered, and their clothes were all contaminated, as well as their body. And for those in the dust cloud, they suffered a massive, massive exposure. So what were those exposures? We know as the towers fell, and these were two 110-story towers, that there was gypsum, calcite, and crystalline silica. There were diesel particulates, carbon monoxide. There was glass, cellulose, and chrysotile asbestos fibers. And don't forget, there were 600,000 panes of glass in the World Trade Center towers. There were mercury and other heavy metals. Computers have many metals inside them, and it was the most computerized office building in the world at that time. There were volatile organics. Benzene, for example, was a component of the jet fuel. And there were also semi-volatiles, so PAHs or polycyclic aromatic hydrocarbons, polychlorinated biphenyls, dioxins, and furans. So in these components of the dust, there are known health effects from a variety of them. And we know from the structural collapse that folks were exposed to cement, ceiling tiles, and drywalls, where they had those exposures that I just mentioned, and the health effects from that can lead to airway and pulmonary irritation. We also know that the silica and the asbestos that was used in the towers are carcinogens. The combustion and there were initial fires, and actually the fires raged for about 3 months after September 11th, led to exposures of organic hydrocarbons and incomplete combustion from the plastics. We know this can lead to cancer, and also there were diesel-powered rescue equipment in the area, and diesel exhaust can also lead to airway irritation and cancer. So over the weeks after September 11th, as rescue, recovery, and restoration of essential services occurred, concerns and controversies began to mount over the potential health effects of the disaster. Now this picture depicts, I like to say this is when day turned to night. This is broad daylight, although if you were at the pile it looked like nighttime, and it looked, rather than the sun shining through, it looked like a moonscape. Now, there was an infamous statement from Christine Todd Whitman, who was the administrator of the Environmental Protection Agency, on September 16, 2001, where she made the claim that the air was safe to breathe. Now, when she was pressed on this later on, there were a variety of caveats. She wasn't talking about the pile. It was actually just talking about asbestos levels that for the surrounding area, which was what they met an EPA criteria for. But the message that got out to the public was pure and simple: the air is safe to breathe. We know this wasn't true, and as a result, a number of programs were established that allowed us to monitor the health of those exposed. In the first phase, we had the World Trade Center Worker and Volunteer Medical and Screening and Monitoring Program Consortium, which was established in 2002 with funding from the Centers for Disease Control and Prevention and the National Institute for Occupational Safety and Health. It was a clinical consortium that provided free medical and mental health exams for those folks who weren't in the fire department, who were involved in rescue, recovery, and restoration of services in the New York, New Jersey area. And a national program was also set up for those folks who came in to respond from areas around the country and then returned back to their home. The Fire Department of New York, or FDNY, had its own program for core clinical evaluation and monitoring, which was funded by the CDC. There was a tremendous need, and the program initially saw about 12,000 individuals. In the second phase, the monitoring program, which began in 2004, there was the medical monitoring program was set up. And that continues to this day, and as we will talk about shortly, it's gone under several names, but nearly 100,000 examinations of World Trade Center responders have occurred through 2013. There have been annual examinations, so some folks have received up to 8 monitoring examinations. A treatment component was added in 2006. Initially, the programs were only allowed to diagnose and not treat. And the clinical centers are funded to provide diagnostic testing and treatment for covered physical and mental health conditions, as well as social services. And this program has been widely accepted and widely utilized with well over 100,000 visits in the program for mental health, physical health, and social work. Phase 4 is the Zadroga Act. And the Zadroga Act was the Zadroga Health and Compensation Act of 2010. In the Zadroga Act, it allowed for 5 years of continued monitoring and treatment for World Trade Center covered conditions. It became an entitlement. It had some strict requirements. It went into effect in July of 2011. So what have we seen in folks who responded to the World Trade Center site? If we look early on from the folks who were in the initial screening program, we found that almost 70% had worsened respiratory symptoms while they were at the World Trade Center. And among those who didn't have any symptoms before September 11th, so the folks that were healthy, we found that 61% developed symptoms while they were at the World Trade Center. And when we measured their breathing test, an objective measure, a pulmonary function test, 28% had abnormal spirometry. When we just confined it to non-smokers, we found that the rate was over double what would be expected in the general population. Now, the general population number even includes folks who may have medical conditions. So this number is very telling. And if you think about the folks who responded to the World Trade Center, these were healthy folks. These were police officers. These are construction workers. These are people doing physically demanding jobs who, in all likelihood, did not have high levels of abnormal breathing tests before September 11th. Now, the data I'm going to be presenting today, unless I tell you otherwise, is for the non-fire department group. Except in this slide, I'm talking about the fire department because they had annual examinations, and what they were able to show was that In the year after September 11th, when they measured the forced expiratory volume in the first second, how well someone's able to push out the air in the first second of that breathing test, there was almost 400 milliliters loss compared to what they would have expected, which is about, everyone loses about 30 milliliters per year. So this was 12 times more than would have been expected. When they've actually followed these folks up, they found that it has never returned to normal. So this is objective evidence of a decline in lung capacity and lung function that persists many, many years after. There was a disease called sarcoidosis. It was called sarcoid-like granulomatous pulmonary disease, which is a disease where folks can get scarring within the lung, they can get enlarged lymph nodes, and they can get disease in other parts of the body. And firefighters had always had a somewhat of an increased risk, and they'd been monitored for many years. But you can see from this slide that there's a tremendous uptick in the year following September 11th. It went from a rate of 13 per 100,000 to 86 per 100,000 in the first year. The rate went back down in subsequent years, but it never returned to the pre-9/11 levels. What's telling about this is it also manifested in a different way, which is that folks now had problems where they had more asthma-like symptoms, whereas before, firefighting was associated with sarcoidosis or sarcoid-like granulomatous pneumonitis, but they didn't have the asthmatic symptoms. After the World Trade Center, they absolutely did. One of the issues that we knew would be problematic early on were the mental health consequences. And a paper that was published with Gene Stellman as the lead author did an assessment of the responder health consequences, particularly with respect to mental health. We found that many folks had mental health conditions, and we also found that it made a difference if you were a traditional responder or a non-traditional responder, and that we also found that there were issues related to access to care, which is that many folks who had high rates of abnormalities in the initial medical screening, only about a third of them had actually gotten care for these symptoms or conditions, and certainly very few had gotten care for mental health conditions. There was even a further breakdown in those who weren't in the traditional first responder category, and these were folks like the construction workers and the cleanup workers. So when we looked at the rates of disease among the responders, police officers had a rate of post-traumatic stress disorder of about 9.3%, but when you looked at the other rescue and recovery workers, the rate was triple that at 31.9%. Similarly, panic disorder and depression rates were much higher in those who had no prior training. When we looked about 10 years later at the three main World Trade Center related disorders, and this is upper airway problems, lower airway problems, and gastroesophageal reflux disease. And by upper airway, I mean the sinuses and the nasal cavity and the throat, the oropharynx. And lower respiratory, I mean things like asthma and asthmatic bronchitis or chronic bronchitis. GERD or heartburn or reflux. We see that the incidence was for asthma about 27%, sinus problems was over 40%, and for GERD or gastroesophageal reflux disease it was nearly 40%. When the firefighters were looked at, as we showed you that slide earlier that showed that there was an initial drop, when they looked at a select group of folks who did some very detailed testing, about 36% of them had recovered completely, which was a good thing. We also found that if you had if your lung function was better at the beginning, and if it improved early on, you were more likely to have lower respiratory symptom recovery in the 9 years after September 11th. So those affected significantly early on were more likely to have problems 9 years later. Those caught in the dust cloud were least likely to recover, And smoking status was also important, highlighting the public health consequences of smoking yet again, which is that folks who were never smokers did better than folks who were current or former smokers. Now, when we look at who made up the screening program, when we looked at the different occupations, the protective services or military was almost half of our population, and this is in almost 27,000 folks screened. Construction was about a quarter, at 23%. Electrical and telecommunication repair workers, these were folks repairing essential services, phone, electrical grid. Transportation or material movers, there were folks that had to remove tons and tons of rubble. And then other occupations which ran the gamut from massage therapists and other volunteers to physicians to public health officials to cleanup workers. And then there were some folks who were retired or unemployed who also responded and were in the program as volunteers. Now in 2011, the fire department published a paper that looked at cancer outcomes in New York City firefighters after September 11th. This was comparing pre- and post-9/11 cancer rates to see if there was an increase. As a result of this work, and work that had been done by others, for example, we had published a paper that found an unusual pattern of multiple myeloma in individuals with World Trade Center exposures that were exposed before, that had developed multiple myeloma decades before it normally appears. This study was one of the first comprehensive epidemiologic studies that looked and found increased cancer rates in thyroid and in prostate, which was unclear what the effect might have been, but that may have been related to the fact that folks were being under surveillance, and in myeloma and other cancers. As a result, cancers were added as a covered condition in October 2012. So under the Zadroga Act, for an individual to receive treatment that is fully paid for with no out-of-pocket expenses or copays, you have to be certified as having a condition, and you also, it has to be a condition that is listed as being a covered condition. So we had conditions that were covered, including the upper and lower respiratory problems, a number of mental health conditions, the gastroesophageal reflux, and 50 cancers or 52 cancers were added in October 2012. So when we think about what were the health effects, we know that upper and lower respiratory symptoms, gastrointestinal symptoms, and psychological symptoms persisted 11 years after they stopped having this exposure. All groups, there have been area residents, there have been the fire department, and the non-fire department, the police, the construction workers. Everyone has the same types of symptoms, the same types of diseases, very similar disease rates. We know that many with initial persistent symptoms received no care or inappropriate medical evaluation and or treatment. And it wasn't that their physicians were bad doctors, they just had no experience in treating an environmental or occupational disease of this magnitude. One of the strengths of this program had been that we linked the mental health component to the physical health evaluation, and it had been very successful in destigmatizing the fact that everyone goes for a mental health screening evaluation just as they go for a physical health screening evaluation. So what have we learned? What might have helped in the first days or weeks? It would have been helpful if there had been a physician advisory to orient treating physicians. Many folks got antibiotics unnecessarily because they had a cough. Well, they had a cough because they were exposed to very caustic dust. They didn't have a cough because they had an infection. It would have been good if we had a registry of information for volunteers or workers, which is why it's a challenge now for folks to prove they were down there, which they must do to be eligible for the Zadroga bill. Rapid distribution of respiratory protection. This is something that befuddled the folks working at the site, which is we saw many people who are protecting their neck with a respirator around their neck, not on their face. They didn't know that they could change canisters on a respirator, and this would have protected many of them from the exposures. There needs to be a rapid mobilization of resources for medical evaluation and treatment, not just the acute the tents that were set up to deal with the injuries on the site, but to think about what people are exposed to and what they might have. It also would have been important to test indoor settings to establish a gradient of exposure with distance from ground zero to guide recommendations, and this included both settled dust and aggressive air monitoring. Much of the monitoring that took place in the early days was related to the components that the EPA has standards for, and those are things like asbestos. Advisories for how to handle office and residential materials like rugs, sofas, and files needed to be consistent. The messages were varied, came from different sources, and health departments were giving mixed messages with the EPA. The advisories on estimates of risk, especially for things like asbestos-related cancer, are important. But there needed to be really a focus on acute effects and less on cancer. As we know, cancers occur years after exposures. We're seeing them earlier than we would have expected, but certainly not in the very acute phase. And so much of the emphasis was on the fact that there was asbestos at the World Trade Center site, which is going to be a problem in the decades to come, but was not a problem in the early days. If anything, it should have been a marker that people needed to protect themselves more. And really, there needed to be a focus on human health experience rather than focusing on air monitoring. You can measure, but if people are coughing, you can say the air is safe to breathe, but when every single person around you is coughing and having difficulty breathing, that should be telling you something as much as whether a filter measurement has asbestos or not in it. And we know asbestos doesn't even cause any symptoms early on, so that wasn't a good marker of something to measure. So I'd like to give you some information if you want to learn more about our Master of Public Health program. Please go to www.hofstra.edu/publichealth, or you can contact Corinne Kiriakou, and her email address is listed below. And we are happy to entertain any questions you might have. So please type them up and we'll try to get to your questions. So one question is, what do you think of Christy Todd Whitman's statement? What do you think it did from a public health perspective? Well, I think that it unnecessarily caused folks to have a false sense of security. I think people heard what they wanted to hear, which is the air was safe. And when you look back, and there was a really interesting article from a public health perspective, it's fascinating reading if you go back and look at the Inspector General for the EPA. You can find that what they wanted to say and what they were allowed to say was very different. They wanted to give caveats, which was first and foremost that this refers to the air around the World Trade Center site, but is not related to the World Trade Center site itself. So I think that we need to be more honest, more open, and be more explicit in when we make a statement such as the air is safe to breathe. Everyone wanted to believe it, and sometimes when you believe something like this, you take risks that were unnecessary and have led to problems that we're seeing many years later. So another question that's popped up is, how far beyond ground zero did these problems show up? Well, you know, folks that were blocks and blocks away, the prevailing wind patterns changed that day. It wasn't the normal way, and the winds went to Brooklyn. So there were actually folks in Brooklyn who had symptoms. There were folks in Lower Manhattan and in Chinatown, and there was actually a study that looked at asthma rates in children in Chinatown and found that there were increased asthma visits among kids in Chinatown, which is to the east of the World Trade Center site, in the months after 9/11, and it had persisted. Certainly in many, many blocks, and for those folks who were in New York at that time, there was this acrid smell that persisted, and when the winds would shift, it was particularly telling. But it was several blocks. It wasn't just at the 16-acre World Trade Center site, so certainly it was at a far distance. Have OSHA regulations changed as a result of September 11th? Well, the OSHA regulations were actually suspended at the World Trade Center site, which is a webinar in and of itself. The fact that they were suspended during the rescue and recovery effort. But the regulations, there haven't been any new OSHA regulations in many, many years. To have a new OSHA regulation, one must go through a very long rulemaking process, and there haven't been regulations that have changed as a result. So the next question is, how long are these programs running for? Well, the Zadroga Act began in 2011, which provided this entitlement, but it was a 5-year entitlement. So unless it's reauthorized, the program that provides medical monitoring and treatment will end in 2016 unless it's reauthorized to continue. Part of the Zadroga Act is also a victims' compensation fund, and there was just notification last week that some of the first awards had been made to compensate folks for lost wages and pain and suffering as a result of the illnesses that they had developed from the World Trade Center. The next question is, should cancers have been added so soon? And is there a problem or condition that should be added that hasn't been added yet? Well, you know, as we learn more, I think that there were many, many carcinogens there. And, you know, when we study in environmental or occupational health, we're very good at studying one substance at a time. We're not good at studying multiple substances together. And this toxic soup of chemicals, we don't know how it is behaving, and there were multiple carcinogens there. So does the fact that there were multiple carcinogens make a difference? We are seeing unusual patterns of disease appearing early in many different individuals. Our next question is, how much monitoring continues for the mental health fallout? And do we consider these patients in the same light as veterans with PTSD? Well, the monitoring does continue for the mental health fallout. And the monitoring program, there's no differentiation between a physical health and a mental health symptom in terms of the screening program. Standardized questions are used for both. And so it's actually been one of the strengths, which is that we feel that many more folks have had identification of their mental health conditions and they've gotten treatment because it's been destigmatized. And everyone has to go see the mental health counselor. You can't say, oh no, I'm fine. You have to go and get screened as part of the monitoring. And we do consider PTSD doesn't care whether you were at war or whether you responded at the World Trade Center. So we do consider them in the same light as veterans. The next question is, how do I think 9/11 affected how the region handled Hurricane Sandy with respect to public health? You know, it's a great question, very topical. I think that there is concern about, for those folks going in and responding, are there adequate protections? Are people wearing the appropriate masks, and will there be any long-lasting health effects? I think that there will be, hopefully, that because the nature of the exposures are different, then the health effects, once folks are able to clean up their homes, will not be long-lasting. Certainly some folks may have allergies and asthma that are worsened. I'm a little concerned for next summer with mental health conditions and PTSD as we get into another hurricane season for those folks, and to make sure that there is an infrastructure that can help folks and medical screening or medical resources to deal with the mental health conditions as a result of Sandy. So our next question is, does the MPH program provide opportunities to work in the World Trade Center monitoring clinic? There are a number of World Trade Center monitoring clinics. There's one on Long Island. There's one in Queens that I have the privilege of directing. There are two in Manhattan. There's one in New Jersey. And certainly we've had a number of folks from MPH programs throughout the community rotate through these clinics and see medical surveillance up close. So there are opportunities. So I'd like to thank everyone for your attention today, and we look forward to Having you back for the next webinars, and please, if you have any questions, go to our website, which again is www.hofstra.edu/public health for information about the public health program, and this will be archived along with other webinars for your viewing pleasure at your leisure. And let your friends know, let people interested in public health know, or let people interested in the Hofstra program know all about this as a resource for the community. Thank you.